Right, back to our coverage of the COVID-19 pandemic and its implications for other health diseases in the country. We're now joined by the Commissioner for, the Chairman of Commissioners for Health Forum. She's also the Commissioner for Health in Cross River State, Dr. Betty Edu. Good to have you join us.
Good afternoon, and thank you for having me.
So we took this report earlier about having a dip in COVID-19 cases, but we also did take a report where the National Primary Healthcare Development Center is now looking to, agency rather, is now looking to integrate childhood immunization at COVID-19 vaccination centers. Now, we understand that a lot of health problems have taken a backseat because of the COVID-19. Of course, it was a pandemic. But talk to us about the implication of the COVID-19 on childhood immunization.
Okay, thank you very much. So again, like you clearly stated, Nigeria has been going through several waves of COVID-19, and from all indications, the fourth wave, which started sometimes towards the end of last year, is gradually coming to a flattened curve at this point in time. However, some persons have said this is due to the number of persons who have taken the COVID-19 vaccine so far. Totally in Nigeria, for the first dose, at least over 14 million persons, 14 million Nigerians who are eligible for the COVID vaccines have had their first dose, and at least 5 million have had the first and the second dose, and then a few others have had their booster doses in addition to what they had initially. We are beginning to see more and more innovative ways to be able to get this COVID-19 vaccines out to people in the public. Cross River State actually started the integration method, and we're happy that the federal government has taken a lead from Cross River State as always, and has been able to implement at the national level. Remember, it's the same health workers that are to give the COVID vaccines that are also responsible for giving the childhood immunization vaccines. So whether it's the polio vaccine or the hepatitis or the diphtheria or the BCG, whichever one that we are targeting for elimination of those vaccine preventable diseases in children, is the same health workers, is the same health workforce that is supposed to deliver this and also deliver the COVID vaccines. Like you said, a lot of attention went to COVID at the heat of the pandemic, but right now we need to integrate it into the general health system where more and more persons can get services and everything is not all about COVID. The strategy is that at the point where you'll be offering this vaccine, whether it is polio or BCG or whichever one, to that child, ensure that the caregiver who comes with the child to receive the childhood immunization vaccination benefits will also receive the COVID-19 vaccine benefits.
Absolutely.
And that's the strategy which we...
This also sort of looks like an emergency response, and that's why I was asking earlier how bad were the disruptions to immunization campaigns here in the country, especially for children, because I know that the director, I think is the NPHCDA, that has now said that it is because of these immunization gaps. That's why we're seeing the cases of the mutant polio virus that we're beginning to see, or vaccine-derived poliovirus. Talk to us about how bad these disruptions were as we paid attention to COVID-19.
Well, in 2020, right, which I would describe as the COVID year, really there was no major form of immunization for children. The childhood immunization vaccines that are supposed to be taken by children between 0 and 5 years, there was a lot of disruptions to it. I want to say up to an 80% disruption to it. Why? Parents were unable to gain access to health facilities. Health workers were bothered. Even the parents themselves were afraid of going to hospital so that you not get COVID or come down with any disease you don't want. And so parents were even scared that children might be affected by COVID. And all of this affected immunization of those kids. So you find a very huge gap between the consumption before this time and during this time. Of course, in 2021, it eased out when the lockdown was over and parents could now take their kids to get immunized in health facilities and the rest of it. However, that gap has still remained, and there's need, very important and very urgent need, for us to come up with every strategy to address this. If we don't give these children the vaccines they need to prevent those preventable diseases, you begin to see them emerge everywhere, like polio is, like measles, the rest of it. You begin to see them everywhere. I can remember very well as a student, it was very difficult to find cases of measles in the hospital, and that was because there was active immunization going on all around the country. But with this break, you're beginning to see even polio, it's all resurfacing again. And so we have a lot of work to do as government, as partners, and indeed everybody, to ensure that this goes through.
We want to prevent an epidemic of other disease in the midst of a pandemic. Thank you so much for talking to us. We're hoping that you get the kind of response you're looking forward to from parents. Thank you for talking to us. Chairman, Commissioners for Health Forum, Cross River State, Dr. Betty Edu.
Thank you.